If you're a prospective student, I would say shadow a neuropsychologist, right? Like if you don't know if this is the right career for you, shadow a neuropsychologist. Definitely do some more investigative work on YouTube or online to see if it might be something that's interesting. Basically, you're someone that is collecting a lot of information, figuring out what tests to give, writing a lot of reports, and then giving recommendations. That's basically what you're doing on a day-to-day basis. And so if that might be something that you're interested in, I think definitely check that out. What is going on, everyone? Welcome back. If it's your first time here, welcome. My name is Dr. Phil Sarpon. Today, we're going to go into an introductory course on neuropsychology. All right, so one of the things that I'll say about neuropsychology, what exactly is a neuropsychologist? A neuropsychologist is a specialized field. If you want to be a neuropsychologist here in the United States, you need to become a clinical psychologist first. So usually you'll go through a PhD, PsyD program, counseling clinical psychology, anywhere from 4 to 6 years. You'll become a psychologist. You'll get licensed as a psychologist, and then you can do additional training, usually a postdoctoral fellowship for 2 years that's based specifically in neuropsychology. You take another exam, a board certification exam, and then now you are a board certified neuropsychologist. There are psychologists that can do neuropsychology. So every neuropsychologist is a clinical psychologist. Not every clinical psychologist is a neuropsychologist. There are clinical psychologists that do clinical psychology that are trained in neuropsychology. For me, I'm a prime example of that. I am a trained clinical psychologist, but I also have trainings and practicums, rotations in neuropsychology. If I wanted to, I could do neuropsychology. Now, could I call myself a neuropsychologist? Probably not, just because I didn't do a formal postdoctoral fellowship in neuropsychology. Do I know how to do elements of neuropsychology? Absolutely. So I think that's important to note, that not every clinical psychologist is a neuropsychologist, but every neuropsychologist is a trained clinical psychologist, even though they don't actually do therapy for most of their time. A day in the life of a neuropsychologist is typically you see a patient, you do a clinical interview, semi-structured interview, you're asking them different questions. Then you do go through a portion of testing where you're either giving them things to fill out, or you're actually testing them based on different things like their executive functioning, their memory, different things related to maybe ADHD, epilepsy, anxiety, depression, dementia, all of those different things, right? And then you will take the things that you use to assess them, so the testing materials, you'll score those items to see where they are, where they fall in the range of, if they fall in the range of the normal average population, or if they fall either lower or above that range. You will typically schedule a feedback session where you'll tell them the results of what you did with them, and then you'll write a report. And that report could be anywhere from 2 to 10 pages of what you've assessed for them. So if they're coming in with ADHD symptoms, you will give them ADHD assessments. You'll score those items. You'll talk to them about what happened as relates to testing them, and then you'll write a report for them. And then they can use that report to either get accommodations or recommendations, whether in school, whether in college. Maybe they can get accommodations for certain types of medications, right? So that is sort of the day-to-day basis of a neuropsychologist. You can be a neuropsychologist and only really do research, but typically neuropsychologists are clinical. They have clinical training. They'll go through grad school, they'll go through clinical rotations, they'll do an internship, they'll do a fellowship, and then they will become, they'll do the board certification process, and then they will be seen as a neuropsychologist. Now, I think the term neuropsychology is going to be pretty protected in the next couple decades. But like I said, right now there's clinical psychologists who don't call themselves neuropsychologists, but they can do neuropsychological things. I think decades from now, that probably won't be as likely. If you're going to do neuropsychology things, you need to be probably a board certified neuropsychologist. Now, that's not where the field is at right now, but that's where it could be in the future. Okay. Okay, so once again, if we're talking about neuropsychology, we're talking about diagnosis of neurological, psychological things using the DSM, which is the Diagnostic Statistical Manual. It's like the Bible of mental health disorders that clinicians use to diagnose certain things. They'll send it to the insurance will reimburse them, da 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 da. You know, that whole formal process of diagnosing. Diagnosis will also inform clinical care. So once you have a diagnosis, then you know what test and what things to do for that person. And then you also have an idea of interventions and recommendations that you're going to give them, right? So if someone has dementia, you're going to give them certain aspects of dementia assessments, and then you're going to have the report style is going to be written in a certain way, and then the recommendations are going to be meant specifically for dementia or Alzheimer's disease. There's also research involved. Again, you know, you could be a neuropsychologist, but not necessarily go into the clinical world, but maybe you're more so in the neuro research world, right? So it really does depend. And I think one of the things that hopefully people can understand is that neuropsychologists are typically working with medical professionals, neurologists, physicians. The physician might be the one prescribing the medication. The neuropsychologist might be the one that's doing the testing. So oftentimes neuropsychologists will work in hospitals, they'll work in academic medical settings, they'll work alongside other medical professionals. I think one of the things that we have to also really tie into is that in the world of clinical psychology, neuropsychology being a specialty of clinical psychology, just like if you go to med school, there's different specialties like primary care, internal medicine. Neuropsychology is a specialty of clinical psychology. Neuropsychology is probably one of the specialties that is most aligned with the medical model and most probably strongly ties themselves to medical professionals because they're doing so many acute things alongside other medical professionals. And so they, to me, have had the neuropsychologists that I've interacted with have incredible, extensive knowledge of the human body, the heart, the brain, the lungs, the physiology. To me, they know just as much potentially as the medical doctor that has gone through med school because a lot of what they know is based on the human body. And so I think that's one thing to know. You know, if you're looking to go into the medical space, but you don't want to go to med school, I think neuropsychology might be potentially a really good alternative for you in that realm. So I've already kind of talked about some of the possibilities of neuropsychology. You can do dementia, depression, anxiety, PTSD. You can go into traumatic brain injuries like TBIs, vascular, different types of Alzheimer's, Parkinson's disease, different learning disorders, right? Reading disorders, learning disorders, things like that. The possibilities are endless in terms of what neuropsychologists can do, whether they are helping people understand where their deficits are, understanding diagnostic clarification, recommendations. They're really kind of, think of them as like teachers. You know, when you go to a teacher, they give you a test. Neuropsychologists are like teachers in that they figure out what's going on. They give you a test to assess the specific aspect of what's going on. And then they give you like a report or feedback on how to improve or to get the help of the interventions that you need from that test. And so, you know, again, if we're talking about planning for different disorders. Oftentimes, once they have a diagnosis, they'll refer that person to their medical doctor, and that medical doctor will then use that report to figure out what type of medication that they might need. I think as it relates to ADHD or dementia, there's so many different treatments that you can do, right? So oftentimes I'll see neuropsychologists, they'll see people for like a few sessions, right? For the testing session and then the feedback session. And then they'll just send them off to people. They're not doing therapy with people typically. They're not doing medication consults. They test people and then they send them off to everybody else, right? So if someone needs a memory training program, they're sending that person, they're referring that person to a program that will then do like memory training or something like that, right? So if they figure out that someone has PTSD or a diagnosis of something, they might refer them out to a therapist or a psychologist to actually specifically do therapy. Most neuropsychologists are not doing the testing and the therapy. They're typically just doing the testing, even though you could see a lot of neuropsychologists doing both testing and therapy as well. So the evaluations are pretty comprehensive, anywhere from 2 to 8 hours. Sometimes I've seen people come multiple days for different kids who are trying to test into high school or college, they might take several different types of neuropsychological evaluations that test their IQ. We're talking about things like age, education, culture. Neuropsychologists have that psychological aspect because they, even you can get the raw data from the test, but you still have to understand what's the age of the person, the education, the cultural background. How does the psychological aspects of this person impact the testing results? Were they tired? Were they stressed? How could that actually influence the results of the test? And the neuropsychological aspect of the test could be memory, language, visual, spatial abilities, motor, executive, more so related to ADHD or dementia, emotional aspects too. They could do personality assessments, right? Things like the cluster B effects, things like narcissism, antisocial, borderline personality disorder, histrionic disorders. They can test for those things as well. So some questions that you might come along with are someone complaining about memory, someone complaining about a decline in mental functioning, someone complaining about struggling if their parent is going to be able to live independently, cognitive, emotional aspects to work, right? Sometimes people need work assessments because they got injured on the job, and so they need an assessment to give to their job to say, hey, these are the results of this study. I need some work compensation potentially, right, to get to where I need to get to. All right, so those are some of the things that they can do. If we're talking about neuropsychology, we're talking about the brain, the frontal, parietal, occipital, temporal aspect of the brain. We can also see a different aspects of the brain in terms of different functions. So motor functions are typically right along the primary motor cortex. Executive functions, like I said, are usually in the frontal cortex. The prefrontal cortex is really responsible for planning, organizing, sequencing, generating ideas. So let's say, for example, if you need to think through something or inhibit, let's say, for example, that you need to study, but you don't want to. You don't have the motivation to study, right? So you need to inhibit the natural desires of not wanting to study and actually have the motivation and the control, the self-control to actually discipline yourself to study, right? So a lot of that is inhibiting and shifting. A lot of that is prefrontal behaviors that are going on. I'm not going to talk too much about these different aspects, but we just understand that even from the prefrontal motor cortex, that connects the sensory aspects to so many variations of your human body. We also know, you may have seen this image before of when Phineas Gage, when he went through his injury, we were able to understand there were different restraint items that were inhibited based on the localization of his injury, right? So there's certain things that we can see that the brain has a lot to do with, especially so when you go through a certain injury of your brain, depending on where it's localized in the front or in the back or in the sides, it's going to impact some of those sensory elements or some of those functions of the brain. If I want to test someone's processing speed, I might do the Trail speed test. If I want to test someone's executive functioning, I might do the Wisconsin sorting test. Now, I'm not going to go into the functions of how to actually go through those tests, but this is what I mean, right? I might see what happens when they draw certain things. That's going to tell me different functions of the brain. We're going to have the somatosensory cortex, like I said, which is responsible for a lot of those sensory aspects of the brain. The parietal lobe, responsible for different sensory aspects of the brain, right? Parietal lobe, sensory and perception. Parietal lobe also has some language components. If you have difficulty with math, if you have difficulty with writing, right? Aphasia is sort of an inability of producing language. Anosognosia is the denial of different deficits, right? So all of these are related to the parietal lobe. So if someone has an injury in the parietal lobe, they might exhibit some of these symptoms. We know visual spatial is really important. And so can someone draw something like this? If they can't, that tells us something about their visual spatial abilities. Occipital, right, is typically related to things that you can see. There's so much that you can gather from the occipital, not just visual processing abilities. If someone's having hallucinations or illusions, like we're going to be able to see, or did they have an injury in their occipital lobe? Like what's kind of going on? Are there distorted visions or perceptions that they're seeing? We know temporal lobe is often related to hearing and memory and language as well. So many of these things, right? Like many of these things, all of these things are connected. There are some localization with all of these things, but from what you can gather, the frontal, the parietal, the temporal, there's still going to be aspects in which they're all kind of related together, okay? The cerebellum is responsible for voluntary movement, balance, equilibrium, muscle tone, and coordinated speech. If there's injury to the cerebellum, we're going to see people kind of swagger when they walk. We're also going to see perhaps different tremors, explosive speech, abnormal eye movements. Those are also related to the cerebellum. So, I know that I went through these really, really, really quickly, but the whole point of going through this lecture series is to better understand that whenever someone's going through a difficulty, whether it's related to their memory, their vision, their understanding of something, their perception of something, their sensory aspect of something, it could be tied to an injury to some aspect of their brain. This is why people need to go through different brain imaging to be able to see if there's something actually going on with a certain region of the brain. If you can verify that there's something going on with a certain region of the brain through brain imaging studies like an MRI or a PET scan or some other type of scan, then what the neuropsychologist can do is that they can give specific tests and measures to test, like, for example, different aspects of parietal lobe dysfunctions, give you a report of those functions. And let's say the person goes through treatment, you can always test them maybe 6 months later or years later to see how they've improved or how they've gotten worse. If they've improved, great, keep doing what you're doing. If they haven't, maybe you need to adjust, talk to their medical professional about doing something different, like some form of other medication that could better help them in some type of way. Again, I wanted to share some of these valuable tools that hopefully you can use. So for students who are going to neuropsychology, again, neuropsychology is not necessarily going to be focused on therapy. Typically, you need to become a psychologist or a therapist first before getting to neuropsychology. But there are some neuropsychology PhD programs that probably focus a lot more on neuropsychology than they do on therapy. So you can look out for those. Just make sure that they're accredited to some degree, because that's going to help you get into the right internships and to the right fellowships and to get board certification and start practicing. Hopefully this was helpful. If you all have any questions for me, please put it down in the comment section below. But with that, I hope to see you all in the next video.